My name is Todd Ring and I work in the emergency department at Royal Island Hospital. The title of my presentation is the Emergency Department Physician Performance Improvement Project. And I do just want to make a couple of acknowledgements as I start as well. First to Ross, my quality consultant as well as to Dr. Devin Herbert and Dr. Sunny Shishgiri, who are both part of my project team. I want you to think about the last time that you needed to visit an emergency department, either for yourself or a loved one within Interior Health. If I was to tell you that the physician that you saw received little or no feedback on their performance, would you be confident in the care that you received? We know that all professionals require feedback on our performance, and yet physicians receive little, if any, feedback. We are here today to talk about the need to develop a physician performance improvement program within Interior Health, and that I believe that by giving physicians feedback on our performance, it will enhance the quality of care for our patients. So my project looked at giving physicians feedback in the form of qualitative feedback. And these were the emergency physicians at the Royal Island Hospital in Kamloops. And this project was building off of the original pilot project we ran there, whereby physicians in the emergency department received quantitative feedback in the form of data reports on their practice. They then were tasked to meet with a mentor and develop a self-learning plan. We were fortunate in this iteration of the project to partner with the Medical Council of Canada through the MCC 360 program to provide qualitative feedback to our physicians. In my project, physicians first did a self-assessment, and then they received feedback, qualitative feedback, in the form of non-physician coworker, physician colleague, and also patient feedback. Following this, the physicians would then be tasked to meet with their mentor and develop their self-learning plan. So we were successful in engaging 20 of 26 members of our department to participate in the project. And at this stage, the physicians are just in the process of receiving their feedback reports from MCC 360. And then following this, in the next coming weeks, they will be then meeting with their mentor and developing their self-learning plan. So the project is still ongoing, as I mentioned. My goal was to have everyone's feedback in place for today, including the survey results, but unfortunately we haven't done that. So following completion of the project, both the physicians that participated in the project, as well as those that chose not to participate in the project, will be surveyed for their learnings and how we can further enhance the process. But we already do have some key learnings thus far. And our first learning is that physicians are engaged in this work. And that is evidenced by the 20 of 26 members participating. But it's fair to say that physicians are still apprehensive about this. And to that extent, one of the other key learnings was that we know that one way to make the project successful is to engage our local physician champions to nurture and help the physicians through the process. And certainly as they've been getting their feedback, that's something that we've been needing to do and was certainly part of the reason for involving other members within the department. Our second key learning was that the patients too are engaged in this process. And as I was soliciting feedback from patients myself, one patient actually said to me that they were surprised to hear that physicians did not receive feedback on our performance, but they were grateful for the opportunity to provide that feedback. And our third key learning was that partnership with MCC 360 was crucial to the success of the project. As I mentioned, physicians were already apprehensive, but by using a third party, it allowed us to overcome the confidentiality concerns because MCC 360 collated the reports and then redistributed them back out to the physicians. And secondly, by using an evidence-based, validated tool such as MCC 360, it did allow us to garner the confidence of the physicians as well. So where does our project need to go? Well, a robust physician performance improvement project includes both qualitative and quantitative feedback. And our next step is to bring both of these components together along with the key learnings of a mentorship and self-learning plan. And that we need to then spread this across other emergency departments and then other physician disciplines within the health authority. So I do think that this is the right time for a physician performance improvement project. And I do believe that physicians are engaged in this, and by doing so, we will enhance the quality of care for our patients. And so my ask of you all here today is to support this work as we continue to move forward to develop and spread it amongst other physician disciplines. Thank you.